Welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers of Ruston, Jonesboro, Louisiana, and El Dorado, Arkansas. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hey.
And today we're going to talk about whiplash. And I read that over 3 million people are affected every year. That is a lot.
That is a lot. 3 million people, and you know, of that 3 million, about 150,000 actually become permanently disabled from it.
Wow.
So that's a lot. So whiplash, just to kind of explain real quick what it is, it's normally caused from a motor vehicle accident. Some other things can cause it, but that's the most common cause. Being hit from behind more commonly, or even from the side. And what happens is when you're hit from the behind, your head is thrown back like that and then thrown forward like that real quick. And it's also known as the acceleration, deceleration injury. And so many things can happen whenever your head gets whipped around like that. And also, if you think, you know, you're not expecting that to happen, so you may be turned talking to someone, or, you know, looking down or looking another way, so it's not like you're in perfect alignment just waiting for your neck to be thrown around like that. So many times, you know, because of the position, it really complicates things. So step back just a minute and talk about the anatomy of the neck. So, you know, our spine is made up of a bunch of bones called vertebrae stacked on top of each other, and the ones in the neck are called cervical vertebrae. There's 7 of them, and they stack on top of each other, and in between each one of those is a disc. That's the cushion between those 2 vertebrae. And where those 2 vertebrae come together on the sides, they're connected by what's called a facet joint, and it makes a neural foramina, or a hole for the nerves coming off the spinal cord to exit out, which are going to innervate the muscles in your neck and down your arms and even in your upper back. So all of that can be compromised, and so many times, you know, you can end up having neck pain. Of course, 90% of the people will have neck pain, but you could also have jaw pain. You could have headaches, you could have dizziness, you can have arm pain or cervical radiculopathy, which is, you know, pain going down your arm from the nerves that are coming from your neck. And very common also is even back pain. So it's very important that you are assessed after an injury. You can actually have much more pain 24 to 72 hours after an impact, and it definitely needs to be addressed then, because remember, acute pain, pain that happens right then, is much easier to overcome than chronic pain, okay? If you don't deal with that acute pain, it becomes chronic pain. Any pain that lasts over 30 days is chronic pain. And then our body, the memory in our cells starts to think this pain is normal, and it's not, and movements that have no reason to hurt. So it can be very debilitating. So make sure with any injury that you address and seek the proper medical attention. Come back in the next segment, and we're going to talk about how physical therapy can help overcome whiplash.